Good morning and welcome to the Stanford Institute for Human-Centered AI, or HAI, or HI, as we call it. So you can call us anything you want. I'm John Etchemendy. I'm the Denning co-director of HAI, and we're at an important moment today, in particular, in the governance of AI. Just yesterday, President Biden signed a comprehensive executive order that was focused on AI, 400, 500 pages, something of this sort. Tomorrow, the United Kingdom will be hosting their AI Safety Summit. There's a lot going on. Recent advances in AI have demonstrated the need for a vastly expanded access to computational resources and data sets. As my co-director, Fei-Fei is fond of pointing out, no university in the country has the capability to train a large language model the scale of GPT-2, much less the current generation of LLMs. This leaves the frontiers of AI exclusively in the hands of the most resourced, primarily industry, and risks a brain drain from the academy. Much is happening, and many policy proposals and regulations are circulating. However, at best, many of these will be difficult to implement or enforce due to a shortage of human capital. Universities are the lifeblood of talent entering the field of AI and will help determine its future. However, this critical component of talent production in the AI ecosystem is also at risk. Beyond the loss of talent and training the next generation, the lack of access to compute and data threatens the types of breakthroughs that academia is historically known for. Unmotivated by profit, academia has helped usher in a vast array of technical advances, such as the internet and GPS, which were only commercialized much, much later. The United States risks losing this source of scientific discoveries in AI if we cannot provide researchers with necessary tools for their work. At HAI, we recognize this challenge, and we recognized it early on, as far back as 2019, and that's why we were the first to propose the idea of the federal government stepping in the way that it did when high-energy physics became infeasible for universities to sustain. We propose that the government provide access to large-scale computational and government data sets in the form of a national AI research resource. Fast forward 4 years, and we're seeing a bright spot of hope in the form of the Create AI Act. This bipartisan bicameral bill was introduced this summer and will ultimately lead to the establishment of the NAIRR. And in fact, yesterday's executive order announced a pilot program for NAIRR within 90 days. While it's great to see this endorsement by the White House, the next big step will be for Congress to pass the Create AI Act, fully establishing NAIRR beyond a pilot program. Today, we're gathered to discuss what a NAIRR would look like in practice and how it can be optimally configured for it to carry out the purpose that it was designed to solve. We will hear from the panel of experts, including HAI's co-director, Fei-Fei and associate director, Russ Altman. The conversation will be moderated by HAI's Data Privacy and Policy Fellow, Jen King. So Jen King also co-authored our study of the NAIRR in 2021. But before we get to the panel discussion, I have the honor to introduce Congresswoman Anna Eshoo, co-chair of the Congressional AI Caucus and author of the Create AI Act. I've had the privilege to work with Congressman Eshoo over her many years as Stanford's representative in Congress. She has long been Stanford's best friend in Congress, helping us with issues large and small, from student visa problems to extracting a student's family during our hasty withdrawal from Afghanistan. Congresswoman Eshoo has also become academic AI's best friend. She's not only the author of the Create AI Act, but was the first member of Congress to seek to establish the NAIRR. She led the effort from the beginning by authoring and passing the National AI Research Resource Task Force Act of 2020, leading us to this very moment. It's only because of her leadership that the NAIRR is so close to becoming a reality, and for that we are immensely grateful. But her leadership on AI isn't limited to just NAIRR. As Congressional AI Caucus Chair, she has been instrumental in moving forward legislation that is vital to maintaining US leadership in AI, as well as our preeminence in science and technology. I'm delighted that she could join us this morning and speak about the Create AI Act. Please help me give a warm welcome to Congresswoman Anna Eshoo.
Well, good morning, everyone. Everyone awake? Good. It's wonderful to be here with you. John, thank you for your very generous introduction. When all these nice things are being said about me, I always think I can't wait to tell my kids what was said. So thank you very much. And thank you, John, for your exceptional leadership here at Stanford. Our country has been so well served by your leadership here as provost, your provost emeritus, the co-director of Stanford High, and with a really extraordinary team with Fei-Fei with I was going to say John Altman. He was part of a previous administration, right? We're on automatic pilot when we say Altman. Russ Altman, to Dr. Jennifer King. This is a consequential team here at Stanford. And what I want you all to know is that Stanford was the university that took the lead on this issue. So you all are a great source of pride to me. And whenever I'm here at Stanford, I always say Stanford is the greatest private university in the world that lives with the shadows of the greatest public university in the world, the University of California. I have Stanford and Cal in my family. So I didn't want to leave them out. So here we are the day after the president's executive order. John has taken so much of what I wanted to say in his opening remarks. But I was so pleased when I went through the highlights of the executive order. And thank you, Mr. President, because there are at least 4 key full areas that I have legislation on. And this executive order, I think is highly anticipated. I think that I know that you've read that in the Senate, the majority leader has taken a lead to meet with the top people in the private sector, really the high-tech community. Other sectors have complained to me very legitimately that they were not included. But that says something about maybe the shortcomings of the thinking about AI and really what the Create AI Act is all about. This executive order, it's called the Safe, Secure, and Trustworthy Artificial Intelligence. It really speaks to establishing new standards for AI safety and security. And it promotes innovation and competition. That's who we are. That's built into, I think, America's DNA. He very specifically in the EO directed the National Science Foundation to establish a NAIRR, a pilot NAIRR. And that's to be stood up in 90 days. And the NSF is already working on it. So I'm very pleased about that. As I said, it mirrors my legislation. Now, every day, every evening I read all of the national clips, from all of the national publications. And then there's a whole nother set of clips from what's happening here locally, not only my congressional district, but throughout the Bay Area and Northern California. And inevitably, I'm reading about a new breakthrough in AI or a new way it's going to be used to benefit society. In fact, many of you here today have been instrumental in that work, and I say bravo to each one of you. We know that AI can provide tremendous benefits to society. It can improve drug discovery and medical treatments. It can assist with disaster response and help us respond to climate change. So it holds great promise. It holds great promise, but it also presents peril. It also presents peril. It's a very interesting set of bookends. The unsafe use of AI can exacerbate existing inequities in society. And we know that there are many or fuel misinformation, something that we live with every day. And I think damaging our society, taking a great toll on our democracy. And it could be used to create powerful weapons or new pathogens. We need to develop AI that is safe, that is trustworthy, and responsible. AI R&D really requires three main ingredients: data, obviously good data in, good data out, computing power, and people. These resources can cost huge sums of money. And large technology companies, as John said in his opening remarks, they really shouldn't be the only ones who have the access to the means to develop artificial intelligence. We have to diversify AI R&D beyond a small number of large entities to protect America's ability to compete and innovate. All sectors of society, including startups, small businesses, community colleges, universities, nonprofits, and the public sector, the government, deserve access to the resources that are necessary to conduct the meaningful and safe AI research that will benefit everyone. The everyone is just so important. It's, in my view, I think your view, obviously you're all here to discuss this today, is essential. So that's really all of the reasoning that went into and the thinking that went into the Create AI Act. It will establish the National AI Research Resource, NAIRR. There used to be a hair remover, I think, called NAIRR. Wasn't there years ago? Yeah. A shared cyber. This is a shared cyber research infrastructure for our country that will provide the necessary resources, as I said, to all sectors. This task force was formed in 2020 through my legislation, and I'm very proud that we were able to get that over the finish line. I might remind you that in a 2-year session of Congress, there are between 20 and 25,000 bills that are introduced in the Congress, 20 to 25,000. About 200 or less, including our national budget, but that's with a question mark today. It's a whole nother, that could be a whole nother institute here at Stanford. Maybe I'll retire and come here and help head it up. So it is, it's a great source of pride to get legislation over the finish line and sent to the president for his signature, and that was signed into law. It identified 4 key areas where public investment would strengthen American research and development in AI: innovation, capacity, trustworthiness, and diversity. So strengthening each one of these areas is critical for the United States to realize the benefits of AI while obviously minimizing its risks. This NAIRR will democratize. I love that word. I love the word democracy. I love the word democratize. I think we have a deeper appreciation of it today because of those that don't appreciate it. But at any rate, come on, Anna, get back to AI. The NAIRR will democratize AI R&D, and our vision is that it will enable really countless American researchers and innovators to develop AI tools, to bolster what needs to be brought forward on our national security, enhance our economic competitiveness, and improve society in numerous ways, bettering America. And what I'm always conscious of, that what we do here in the United States of America can benefit all of humankind. It's not just us. It is this world. And we have a troubled world today. But well, let me just close on this note. I commute across the country every week. I think travel now is really hard work, especially in seat 43D. But at any rate, once we get to 10,000, 16,000 feet, whomever's sitting next to me will say, "So what business are you in?" And my response is always this: I'm in the business of hope. And I think that you are too. So that's why our work together, the leadership of Stanford in this key area that has so many people standing on their tiptoes, and that we can remove the elements of fear and what some may find menacing in this, to celebrate the promise of AI to improve people's lives, certainly across the country, but around the world. That's why this work is so important. I am so indebted to the leadership of this institute for their early work and vision in this. Stanford is the leader of this in the country, and it's humbling for me to say that I represent Stanford University. So thank you again for this gathering today. It's an enormous honor to be with you, and I look forward to coming back and reporting to you that we got the legislation over the finish line and that President Biden signs it into law. I think the executive order put me in a very good mood yesterday, and I think all of you as well. So thank you, and have a wonderful gathering today, and know that everything that you do here really does count. I'm so glad we're in the business of hope.
Good morning, everybody. Thanks for joining us. Thank you, John. Thank you, Congresswoman Eshoo. I'm Dr. Jen King. I'm the Privacy and Data Policy Fellow here at HI. It's very exciting to be here on the day after the EO came out. I spent all afternoon poring over every single page. Maybe some of you have as well. Let me introduce our two panelists today, and we'll talk more about the NAIRR and what it will mean for academia. So first, Dr. Fei-Fei Li is the inaugural Sequoia Professor in the Computer Science Department here at Stanford, and the co-director of Stanford's Human-Centered AI Institute, where you sit right now. Previously, she served as the director of Stanford's AI Lab from 2013 to 2018, and vice president of Google, and chief scientist of the AI and machine learning at Google Cloud during her sabbatical from Stanford from January 2017 to September 2018. Dr. Li's current research interests include cognitively inspired AI, machine learning, deep learning, computer vision, robotic learning, and AI in healthcare, especially ambient intelligent systems for healthcare delivery. Dr. Lee has been working with policymakers, Senate and nationally and locally to ensure the responsible use of technologies, including a number of US Senate and congressional testimonies, and recently as a member of the National Artificial Intelligence Research Resource Task Force, the NAIRR. So Dr. Lee, please, welcome. Joining us will be Dr. Russ Altman. He is the Kenneth Fong Professor of Bioengineering, Genetics, Medicine, Biomedical Data Science, and by courtesy Computer Science here at Stanford, and past chairman of the Bioengineering Department. His primary research interests are in the application of computing, AI, data science, and informatics to problems relevant to medicine. He is particularly interested in methods for understanding drug action at the molecular, cellular, organism, and population levels. Dr. Altman helps lead a FDA, Food and Drug Administration, supported Center of Excellence in Regulatory Science and Innovation. Previously, he has chaired the Science Board advising the FDA Commissioner, served on the National Institute of Health's Directors Advisory Committee, and as co-chair of the Institute of Medicine Drug Forum. Welcome, Russ. Okay, great. So let's get started. We heard from Congressman Eshoo just now about the tremendous opportunities that the NAIRR is going to bring to academic researchers. I'd like you each to give us an example from your day-to-day work that illustrates why the NAIRR will be such a resource for academic labs and researchers, and how compute and data resource restraints affected you and your students' work. And actually, Fei-Fei, I'd like you to start. John mentioned this during his opening remarks, and I also heard you talk about this publicly. The idea that I think you said, and please correct me because I don't have it memorized, that no research university, or maybe all the research universities, have the capacity to build something like ChatGPT today. And I thought that was just a tremendous example to help the public kind of understand the deficit we're operating at.
Thank you. Thank you for the invitation. Before I answer Jen's question, I do want to just personally thank Congresswoman Anna Eshoo for all your effort. John H. Mundy, Russ Wald, and many of us are behind the scene over the past years pushing for this NAIRR bill, as well as the other things in the EO. I do want to say, without our tremendous representatives from both sides of the aisle, we wouldn't get to where we were yesterday. So just want to acknowledge your tremendous leadership. Thank you so much, Anna. Now the gloomy talk. So yes, we don't know the exact number, but it's estimated it takes tens of millions of dollars to train the ChatGPT model. And that probably amounts to thousands, if not tens of thousands of GPUs that are used. I am not aware of a single university in this country, or maybe worldwide, that has more than 1,000 GPUs, because I've been asking my friends all over the country. Frankly, at Stanford, we're jealous if we hear someone who has 300 GPUs. So by that estimate, not a single university can train a ChatGPT model. And I'm wondering how many universities combined, if at all, can train a ChatGPT model. And there is tremendous implication to this, I think we'll dive into. But Jen, you want us to open with an example of what we cannot do. Honestly, Russ and I can sit here and talk forever. This is right now, it's still October. Most of my students are coming back from their summer internship at the big tech companies, which is a very healthy exchange of talent. And all of them come back with results showing me things like diffusion models, the latest generative 3D, algorithms. And I get wowed by their results. And the standard answer to me is, Fei-Fei, we can only do this at Google or at Meta or whatever. But my single example for you is about 3 months ago, my healthcare ambient intelligence team researchers, PhD students and postdocs and junior faculty came to me and said, Fei-Fei, we have to delete data. I'm like, what do you mean delete data? What data are you deleting? So Stanford just built a new hospital. And over the course of building this hospital, our research team has convinced the hospital leadership to pilot a program called ambient intelligence to put smart sensors in the form of privacy protected cameras in ICUs. And this is a project to use smart sensors as a extra pair of eyes to help watch patient safety, such as falling out of bed or unintended protocols in, say, hand hygiene practice in healthcare delivery. These have dire consequences for our patients. But it's the dark space of healthcare. It's hard to use human eyes to watch our patients or our clinicians to do everything. We need smart cameras, smart sensors to help us, guardian angels to help us to improve the healthcare delivery and safety quality. And that's the sensors. And we collect continuous videos of these patient rooms as part of the research program. Well, anybody who works in computer vision knows continuous videos means the amount of data. And after, like, say, 2 months of collection, we have petabytes of data. This is the first time the research world ever had continuous video of live, real clinical setting data on, on these complex situations. It is precious. We can use this to train models to help improve patient safety algorithms. Yet, we don't have enough storage. We do not have compute to process this data, to the point my students came to me and said, we have to delete data. This is hundreds of days of work, years of work. This is, so much effort by so many clinicians, hospital leaders, generation of at least 2 generations of PhD students, getting us to this point that we have preliminary capability of doing this research, yet we don't have the resource. And right now, what I told them is to go through these thousands of hours of videos to delete some of the boring stretches, because sometimes patients do leave the room and you do have boring stretches of lung activity. So right now we're getting by to keep the precious data, but that's just storage. We still don't have compute we don't have the GPUs to process our algorithm. And that's the example, real example.
Yeah, so I'm going to tell the same stories with just different details. So, I've been a professor here for 31 years, and the big secret that I'm now going to publicly disclose is I don't do any of the work. So my students all know this. The students, the postdocs, the staff, they're the creative ones doing the work, but I'm supposed to create the environment to let them do the work. So for the first time in my career, about 6 months ago, my students started coming in independently and saying, we don't have enough computers to do this project that you asked us to do. And so that's a failure for me. Like, I'm the PI. I told you already, I don't actually do anything. So my only job is to give them the environment that they need. And I couldn't give that to them. And this was 3-4 students coming in. And, it's a hard conversation to have with your advisor because, I'm somewhat key to their future. So that was a big wake-up call. And I think that my colleagues all over the university and already all over the country have had identical, especially, God forbid, they go into industry for the summer, because then they come back and they're actually angry. Like, how come Merck? I work in biology, drug. So I had a student who did an internship at Merck. Well, Merck has a lot more GPUs than we have. I could get certain things done there. So, okay, that sets up the problem again. So let's be a little bit more positive. What are we using it for? So there are biobanks that have emerged in the world. The United States has the All of Us resource, which I know that Congresswoman Eshoo has supported. It's nearly 1 million people who have donated all their health data, a lot of sensor data, their genomic data, and even lifestyle surveys, and all in the name of donating this data for discovery so we can understand human health, human biology better. The UK has already also done this in something called the UK Biobank. So we're working on algorithms that look at all this data for a very simple idea. Can we predict the diseases that you or others are at the highest risk for, so that your doctor has a little warning and could then maybe do some early detection to get things before they've caused a lot of health problems for you? Can we detect that cancer early? Can we see the early signs of diabetes, the early signs of depression or schizophrenia? Every physician will tell you that it's much easier to deal with these things early on than later. So my student, in completing her PhD, looked at 500,000 patients and looked at 40,000 measurements. If my math is right, that's 200 billion data points. And she wrote an AI algorithm that predicts the risk of every one of 12,000 diseases for all 500,000 of those patients. She got her PhD. She's very happy. She's going on to do more. Well, guess what? That took a ton of computation. Her runs are one of the things that made the computer not available to the other students, right? But she was a senior student. She got priority. But guess what? When you do something like that, it's never as good as you want it to be. So the next several years will be my group tweaking things and running those 200 billion points through a slightly different algorithm over and over again. We cannot do that with our lab resources. And so just to answer your question, the NAIRR, I'll smile for a moment because I too remember the product, and the commercials on TV. Anybody over 50 might remember those. The NAIRR will allow us to do these kinds of things. And let me assure you that our lab is one of many innovating in healthcare for diagnosis, for new treatments, for prognosis. And so all of this is incredibly
Jen, can I
Yes.
ask one thing?
Please.
I do want to put a couple of numbers. The Create AI Act bill is proposing $2.6 billion of compute resource and data resource over 6 years. And a lot of you who are in Silicon Valley knows every other week we hear news, a startup, be it celebrity startup, gets 4 billion investment from AWS or 10 billion investment from Microsoft and all that. I do think, Anna, you called it drop in the bucket. I do think this is so critical, but I don't want to paint a rosy picture as if NAIRR solves it all. I just want to put the numbers into all of our head here.
So we know the NAIRR will bring both federally funded compute resources and also access to government data sets to researchers across the US. Russ, I'd like to ask you to elaborate a little bit on what you just said. I mean, so obviously you've already talked about some of the ways in which you're using this for science, or you would use resources like these, I assume, for scientific research. What is it that you can do that you don't see Merck, for example, doing? Like what is the advantage here that you see academia having by this resource?
So it's a great question, and it really is always the same answer. We need to be upstream of Merck. So they're developing drugs and they're discovering drugs, and they do a pretty good job, and they've had a good run. COVID, the drug industry has saved a few 100,000 million lives. However, they have timelines and quarterly milestones that make it very difficult for them to take the long view on big unsolved problems, like understanding the basic biology of disease. And when drugs fail, this has been studied, it's because there was too much of a narrow understanding of the underlying biology. And if you had spent more time, more effort, maybe would have learned a bigger piece of the biology and realized, oh, this drug is not going to work because there are other pathways that we're not considering. So the kind of work we will do with NAIRR is upstream understanding of biology. So I'm sure you're all aware of the ability of my experimental colleagues across the street to make measurements of the genome, the transcriptome, the metabolites in your blood, the proteins in your blood. It's just exploding. That's great data, but we need to turn it into biological knowledge, the understanding of the pathways by which various biological phenomenon happen. So we're working upstream of that. Those discoveries are exciting, and they inform things like drug discovery or new diagnostics, which we then let the industry do. Industry can't make that kind of long-term investment because it's too broad, it's too wide, and they really depend on the academy to help them lay that groundwork so that they can develop drugs.
How about you, Fei-Fei?
Well, I want to give quick example, one historical and one, actually a couple of historical and one future looking. I do want to remind everybody where we are. We are in a deep learning revolution, AI revolution, and two very important ingredients that set forth the entire AI revolution since a decade ago. One is the algorithm, neural network algorithm. The other one is dataset. And if you want to trace back the history of neural network algorithm from perceptron all the way to the most important learning rule, which is backpropagation, and then the convolutional neural network, all of this were done in academia. Because as Russ said, that's called upstream research. Second is dataset, and I have a little bit of personal experience. When 2006, when my students and I were thinking about ImageNet, this would not have been a project that industry would do because it was so blue sky, it was so crazy, it was so, strange. But that's what academia is about. We explore, we hypothesize, we trial and error, we go after curiosity. And these convergence of these two things get us today's AI blooming. And now if you go after this, you go upstairs, just right on the second floor, you will see our students are tinkering with robots. My own students are working with robots on 1,000 household activities, from folding laundry to cleaning toilets. All these are just really a curiosity-driven research that would downstream. These same robots that are taught to fold laundry and carry laundry basket would eventually become a disaster relief robot, to save people and save things from earthquakes. But it takes time. And that's what we're doing. And of course, I already gave the example of the hospital. So that's what academia research is about.
So both of you already hinted a little bit at this in your remarks. So we have a severe AI talent drain from academia to industry. So those summer interns go get a taste of what they can do in industry, and then off they go. Our AI index report here at High showed that last year, fewer than 40% of new PhDs in AI go into academia, and only about 1% go into government. So that means about 60% actually are heading into industry. So how has this brain drain affected your work? And do you think the NAIRR could have a meaningful impact on retaining and attracting AI talent in academia?
Well, first of all, I think we do need to acknowledge that, especially here in America, especially here in Silicon Valley, that talent exchange is a healthy thing, right? Like, we have a porous structure between public sector, academia, and private sector, and hopefully more government. And that just allows people to bring experiences, insights in and out of these revolving doors. And that, if that's done well, and if that ecosystem is balanced and healthy, I think is the secret sauce of why we're so successful. And so I'm not fundamentally categorically against talents going to industry, nor vice versa. But what we see now is that the draining is very asymmetrical. Just here in this department, we see incredible researchers having to leave academia to do the kind of research and translational work that they loved doing here. They could have continued to be members of this community for future students and colleagues, yet the draw of industry, as well as the old unupdated rules of academia, make it hard to keep them. And also now the new generation, my students, they basically look at the following thing. One is where their friends are. That's the most important thing. And their friends are all, having free food at Google or, Meta. So that's like 90%. Second is where the resource is. And the data sets, I just said, and the compute are in industry. And last but not the least, the compensation is so, is asymmetrical, and that means we won't have enough talents staying public sector, doing the kind of exploration that Russ just talked about, this kind of scientific discovery. We won't have these talents to train the next generation talents. And then government, Jen, you yourself can comment on this. Technology moves so fast. Our policy making, our government work itself needs a level of understanding and expertise. If we've got no one understanding what this technology is, how do we imagine thoughtful and sensible policies, be it regulatory or other types of policies? So these are this is the reason we're concerned.
Yeah, I know we're running low on time, so I'll just add, I totally agree with what Fei-Fei just said, and I'll add 2 points. The thing that we're seeing that we didn't used to see is fully trained academic professors leaving their jobs, which means that the investment we've put in not only in their research training, but in their teaching and their ability to participate in the university, when they leave, that's really like cutting off the head. Secondly, it makes it very difficult to fulfill the university mission of achieving diversity, because diversity candidates now already have a set of challenges to succeed, and now they're being asked to operate under suboptimal monetary and other conditions, and so it puts the university's diversity mission, and it cuts off the head of the university in terms of fully qualified faculty, thus putting the future generation training all in jeopardy.
We're going to move on to questions in just one moment. I'm going to get one last one in before we open it up to you all. And it's you both. So, a lot of the focus we've talked about so far has been on compute and access to compute. Data is another big piece of this. The NAIRR specifically calls out both compute and data and access to data. You both create your own data, as I do as an empirical researcher. And I'm just curious, kind of, what do you see the promise in something like the NAIRR? Would you contribute your data potentially to, obviously, Fei-Fei, you created ImageNet. But I'm just curious, where do you see the opportunities on the data side with a resource like the NAIRR?
I do. If you look at the next level, and you know this very well, the NAIRR talks about a NAIRR secure and a NAIRR public. I can't remember what the 2 words are, but even in the legislation, they recognize that private health data, which is an unbelievable resource for discovery, it's also unbelievably sensitive, and we don't want to lose the trust of the participants who agree to use their data. So methods for privacy protection are absolutely critical, and this is an active research. Our group is doing work on creation of synthetic data that mirrors the distribution from which the patient, for the distributions of data, but is actually fake patients that look real, because that has a certain role. And then fairness in algorithms, and so all of this needs to be paid attention to. And it's an active research program, so I don't want to be Pollyanna-ish that we have this all solved. But I think our people are very aware in the health domain that if we don't solve this, the entire enterprise can come to a standstill.
So I actually served on the NAIRR task force by President Biden for 2 years. That's a 12-people task force. And I was very much in the discussion of data. It is true, you're right. Most people just think about NAIRR as compute, but I'm personally so excited that we are going to have this effort for a national level data commons, data repository in different levels of security. And first of all, I literally have been thinking I'm going to put ImageNet on the NAIRR because it's just a Stanford server hosting it anyway. So, but there's so much to unlock. Think about what the government's public data, such as the firefighting data, right? Like California, welcome, and earthquake data, ocean data, climate data, healthcare data, transportation data. I think this is where we not only will have a resource for people to do research, we're going to turn the tide of attracting talents, because suddenly that will have an opportunity for talents whose life's goal is not advertisement optimization, who wants to do scientific discovery, who wants to contribute to public good. We're going to have that resource and opportunity to use this data and to contribute to this data. So that really, truly makes me very excited.
All right. So I think we have a roving mic. If anybody wants to ask a question, raise your hand. The mic will come to you. Be brave. Yes, we have one up here in the front.
Thank you so much. Very insightful. So I'm thinking of use of these national resources, right, for broader picture. For example, health equity, not just in the US, across the board, or some many other problems that you already can think about. So how really we can leverage these national resources for global problems?
I'll just say that two things. Much of the NAIRR is analogous to an old program that some of us remember called the supercomputer centers that NSF supported in the 80s and 90s. And they had a pretty good track record of making resources available to under-resourced countries. So that's just and I'm assuming / hoping / presuming that that will be part of the NAIRR mission. In addition, when these resources start growing up in multiple sites, there's often an opportunity for federation for really big problems. So I don't want to be overly optimistic, but in the genomics world, which is where I live in, there's a genomics project in the US, there's one in the UK, there's some in Africa. There's now a group that's looking at global harmonization of those biobanks so that we have an even bigger N to answer even tougher questions. I'm hoping that ethic will spill over into NAIRR and its siblings around the world, and we might have a very robust global collaboration. That I don't think exists yet, but I'm optimistic.
Yeah, well, two things, right? I agree with Russ. A lot of these problems are global, like ocean, healthcare, climate. That itself will have that property. And also, from the summary of the EO, and Jen, you read the hundreds of pages. I see that Biden administration actually explicitly talk about international partnership, right?
Yeah.
So I think that's called out in the EO. So let's see how that manifests.
In the back.
Thank you so much for this wonderful panel. In terms of public sector AI research, what are the policies coming down in terms of, you mentioned algorithmic fairness and monitoring AI for bias?
That is a hard question, which I may punt quickly to Fei-Fei. There's been a lot of discussion about federal regulations, and it's mentioned in all of the documentation for the NAIRR. But the devil is, what are you actually going to put down on paper as a regulation that is fair, useful, and sufficiently clear that companies who can actually implement it? So I don't know. I don't know where that is, and I hope maybe some of my colleagues do know, like Jen.
Yeah, in the NAIRR report that we wrote, we called out kind of ethical social review as part of the process. Those of you who are in computer science now know that for the most part, your research will never be seen by an institutional review board, an IRB, mostly because you don't deal with people. But even so, I think Michael Bernstein in particular here at Stanford has really pushed on the topic of having technical research, engage with ethics and society. And you're seeing more and more conferences, I think, also ask in journal submissions for these ethical review statements. And so we did integrate that into our NAIRR proposal as an important piece of asking technical researchers to really engage with these issues, as well as include kind of ethical review as part of the process of getting research approved for use of the NAIRR. So we'll see how many of those details are actually picked up, but we definitely called it out in our report, and there's a whole section on it as well. Other questions? Actually, okay, next. Sorry.
Thank you. Thank you for the wonderful panel. My question is, so data and compute are two important ingredients for the research. So compute part, I understand. Will the data be available for startups through this resource to develop algorithms and research?
So that was part of the discussion of our planning. I think the devils are in the details. We have to see how Create AI Act bill comes out with all the specifics. But one thing that was tossed around is federally funded startups. because there are those SBIR and all various, forms. So I don't know if we have all the details of, say, venture-backed startups and all that.
We have a question up here, if you can bring the mic forward.
Thank you both so much. I think just one question, Amala Yusuf, Stanford Amy. I think one question is around data use and data access is that we have seen that many of the hospitals or health centers would be more inclined to use, like rather than sharing their data is to use weights, and specifically with Gen AI and all this type of things. What is the vision for the type of data that we'll be using, and is weights going to be sufficient to replace our need for data?
Yeah, so it is true that hospitals are very attracted to federated learning schemes where they don't have to have the data and it's for very understandable and good reasons. And that's especially important in areas of women's health and other sensitive, where in other states we're seeing people, getting subpoenas for data to see who goes to clinic X or clinic Y, and that's just a bad situation. So the federated learning aspect of this is critical. But then it becomes, okay, how are you? Will the NAIRR support that? And how that doesn't sound like something that would be data that you would export to a secure site. So I think there's a parallel development of computational capabilities where it's much more distributed that needs to happen. And I don't know if that's part of the NAIRR bill or not.
I don't know specifically. I will say in our report, we talked a lot about technical privacy measures, and actually the executive order that came out yesterday also was very heavy on talking about, they didn't actually name any of the specific technologies, but now my mind went blank because I'm sitting here in front of all of you. But there's a whole host of technical privacy measures that we could discuss that I think the executive order is pushing on. My sense when we were working through the NAIRR report and talking to federal employees, this is a really complex issue because of the Privacy Act that actually protects our data and used by the government. That they really saw kind of technical privacy measures as a way forward, so that you can kind of be at arm's length and potentially access data without actually holding that data. And again, from the executive order yesterday, I think more of the same. People are seeing a lot of promise and hope, and probably within the respect to trying to adhere to the Privacy Act, that may be the only way forward in terms of allowing agencies to exchange data or allowing the public to have access to data that is protected, would be through things like differential privacy or I'm not going to go into all of them. Yeah, exactly. As a way of trying to have your cake and eat it too, essentially. But whether those different techniques are going to be responsive, will it slow down compute and so on? I think that's a different debate, but that is mostly what I'm hearing at this point.
I do want to add that technically there are two layers. Technically, there is a whole family from differential privacy, homomorphic encryption, dimensionality reduction, face masking, and all that, right? Federated learning is one of them. It's actually technically hasn't proven to work that well anyway. I think we're gonna see a lot of these different approaches. But zooming out, we do have to recognize that some of the research needs the raw data. We cannot just assume it's only weights that are shared. So we have to see all the details like secure data and all that.
And I mentioned our synthetic data efforts, and for healthcare, that's one of the main motivations for it. And it is not proven yet, but the dream is synthetic patients that match the distribution of the real patients where you can learn on it without putting anybody's data in jeopardy. But that is still aspirational.
We have time for at least one and maybe two more questions.
Hi. So there's an attempt to catch up with OpenAI, ChatGPT, and those things. And what I feel is research is trying to construct more data-hungry and compute-hungry models, which doesn't align a lot with the middle portion of the industry, which is also going through computer crisis, which is also going through a data crisis. So do you think this will add on to that divide where the models that you're developing, the data that you'll be developing, that you'll be procuring will be making that divide further and making the research inaccessible to the industry, which is in the middle, not essentially at the outlier with a lot of funding?
So first of all, I'm going to push back the assumption that what we're doing is to compete with industry. Depending on how you define compete, I don't think most of the academic researchers are sitting here thinking once we have NAIRR, we just have to create another ChatGPT or GPT-4 or whatever. I think that what this is allowing is much more creative, curiosity driven and a broad spectrum of multidisciplinary research. So from that point of view, what makes America's innovation ecosystem so healthy, or at least relatively healthy, is the complementarity and then potential partnership, right? So and the same with data sets. I think public sector holds data sets that are just so unique. Not only in the data sets, we are hypothesis-driven research. Our ideas are just different from what many of the industry-driven research, and that's what NAIRR is about. That's what academia is about. So I don't see this through that kind of competitive lens. I actually see it as a complementary lens.
I agree, but I do hear you that if you want to do a startup in this area, it's very difficult to imagine what's my path to compete with these giants. And of course, as we all know, sometimes you start a company and your entire plan is to be acquired, but sometimes that's not your plan. And so I do think that we owe some thought to how small businesses that are startups can get access to both compute and data that kind of levels the playing field for really good ideas. The garage-based startup is getting harder, and it was never a thing in biology, by the way. You just can't discover drugs in your garage, but it was a thing in tech, and that is now becoming more difficult to imagine, which I think a lot of us are regretting.
A parallel conversation in that is really open source. That is, we're not going to get into that, but there's a huge conversation and effort in looking at open source efforts versus closed source that will have deep implication to startups and that kind of competitive landscape.
All right, with that, we have maybe very short, 1 more minute. Make it quick.
This you mentioned about the collaboration, the ecosystem between the public and private sector. Do you have any tips on how to build that, especially what's the institution like Stanford's role in helping building a healthier ecosystem?
Well, we have a wonderful office called the Industry and Partnership Office, and raise your hand if you come from yes, Mark standing in the back. So you and panels right here, and also David, right? Anyway, you've seen the faces. Go talk to them.
Right. With that, I think we are out of time. Thank you, Fei-Fei. Thank you, Russ. John. Thank you all for coming today.